So let us start with Nash Therapeutics study streak for today. And we discussed a couple of liver remedies yesterday in the previous session. That was aurum natrinatum and leptandra. And how Dr. Nash has shared his own experience of troubles and how he got cured and what he learned. Something fascinating, something interesting, and something which was new to him about the name of the remedy, which he found very similar to another remedy of the same family. And today we go further with the next remedy which Dr. Nash mentions in his therapeutics, leaders in homeopathic therapeutics. It's the remedy Berberis vulgaris. Now we all know the peculiar symptoms. If we don't know, we can go through different materia medicas for the peculiar symptoms. And we'll get some idea about it from one author, from the other author, from the third author. But what Dr. Nash gives is just a distillation of what is the clinical importance of the remedy from the patient perspective and what he has seen in his practice. The first thing he says is bruised pain with stiffness and lameness in the small of the back, rising from the seat with a difficulty, backache worse when sitting or lying, especially when lying in the bed in the morning, and sensation of numbness and stiffness and lameness with painful pressure in the lumbar and the renal regions. And then he goes forward and Dr. Nash quotes Gumsi for telling about Berberis vulgaris that it is a very good old remedy in the troubles of the back, and it is a remedy which is similar to Rustox. So all the cases where you have failed with Rustox or you are failing with Rustox or you find symptoms like Rustox, give a thought to Berberis vulgaris. In backache, lower backache, rising from the seat with difficulty. Patients will tell you that I just cannot rise, with strong energy from the chair that I'm sitting, from the bed that I'm lying. Berberis vulgaris is going to relieve such complaints. There are many other remedies like Thuja is also one of the other remedies which has pain in the back aggravated by straightening the back. The back is like that, lying down, and when you straighten the back, there is a pain. That's Thuja for uh, you know some patients. Of course, Rustox also, you can say Bryonia also, Medorinum also, Sulfur also, but you'll have to find out from other modalities, or if there is just this one modality, find out if there are any connecting troubles. Like in Berberis, it is connected to urinary and kidney troubles. So, in this way, everything in Berberis vulgaris is connected with the pain in the back or pain in the or the disease is seated in the kidneys, ureters, bladder, and the entire lower back region, the flanks, which is what called in some colloquial terms. So Berberis will have urine, and it's very disheartening to know that very few homeopaths will tell you how to identify the patient on the basis of urine. If any one of you have attended Allen's keynote study streak, which I have conducted in the past, and some of the Nash therapeutic study streak, I have given clues on how you can, from the urine routine itself, diagnose certain remedies or certain types of remedies. In fact, in one of the workshops I took, which is renal calculi workshop, and I was just going through the recording few days ago, and I found that some remedies, I conveyed to the audience that some remedies are suited for acidic urine, some remedies for alkaline urine. And if you are able to find that from a simple rupees 100 test, which is urine routine, we all want to find out about the mind symptoms of the patient, which is intriguing, but we don't want to pursue something which is simpler, which is urine routine. And in Berberis vulgaris, if you see, urine is turbid, flocculent, clay-like, copious mucus sediment, reddish, mealy sediment, or it is blood red. So whether it is acidic alkaline, I have conveyed in the renal calculi workshop, where I have told that this is the most frequently remedy I used in all the urinary troubles. And in Berberis, the complaints of urine or the changes in the urine are always connected with pain in the back. Another very close remedy with urinary troubles connected with pain in the back is solidago. So in Berberis, you will have bubbling sensation in the region of the kidneys, back troubles, weakness in the back, and you will see a typical constitution which is what you cannot ignore, and that is earthy complexion, sunken cheeks, hollow eyes, and blue circles. So it's a telltale face. How it has been conveyed by many authors for some remedies. This again over here for Berbelis, it is pain in the back with the telltale face of earthy complexion, sunken cheeks, hollow eyes, blue circles, and the patient seems to be having the weakness connected with the urinary troubles. So you have a very good remedy which you can give to patients who have low EGFR if they have pain in the back, or their creatinine is rising and they have pain in the back, or their urine routine shows disturbances which we have just learned. These are the simpler things which a homeopath should master first before going to something that is more advanced, more complicated, and more intriguing, that is the mind. So stick to Nash Therapeutic Study Streak, and you will learn amazing stories of how Dr. Nash, with the help of the basic remedies, cured so many cases and gave us so much inspiration through his books and therapeutics. Follow Homeo Setu YouTube channel, WhatsApp channel, Instagram, Facebook, and you are going to learn something amazing in 2025. That's all for today's session. If you have missed the session, go back and do watch Alan's keynote study streak, because we have a certain limit to put the live sessions continued on the Instagram. We will be pulling it down again. So if you want to really master Alan's keynote study streak, Nash Therapeutics, go back to the recordings and find out about the remedies and stay connected.